September is National Recovery Month, and SilverSummit has partnered with the High Risk Pregnancy Center to support its Mother program.
Joining us now with all you need to know on the maternity facility and their treatments are Nadis Venegas Morales, Dr. Farsad Kanyar, and Janine Baumert. Good morning.
Good morning. Good morning.
Thanks for having us.
Yes. Janine, can you give us an idea of what the High Risk Pregnancy Center does and what the Mother program is all about?
Yeah, so the Mother program stands for Maternal Opioid Treatment Health Education Recovery Program. The High Risk Pregnancy Center implemented this program as a level 1 outpatient treatment program specific to opiate use disorder during pregnancy and postpartum. Some of the services we offer are substance abuse counseling, medication used for opiate use disorder, including buprenorphine and naltrexone, addressing other co-occurring mental health disorders, and advanced maternal fetal medicine. To date, we're currently the only program in the state of Nevada providing this service specific to pregnant and postpartum individuals during this devastating crisis, the opioid epidemic.
Yeah, Dr. Kanyar, what are the medications that are typically provided and how beneficial are they to the mother and to the baby?
Yeah, absolutely. So commonly unknown fact, unfortunately, is that for 10-year-olds to 50-year-olds in this country, the #1 cause of death by far and away, not even close, overdose. And unfortunately, the majority of those overdoses are due to opioids, most recently with fentanyl, right? Fentanyl making its way into the drug supply. And the single best tool that we have are medications for opioid use disorder, medications like methadone and buprenorphine and naltrexone, like Janine had mentioned. But our evidence shows that during pregnancy, by far and away, the most beneficial medication for both mom and baby is buprenorphine. So that's why we use that medication during pregnancy.
Okay.
Some of the reasons are decreased risk of overdose, less medication interactions and side effects, and then importantly, the neonate. Because these neonates can experience withdrawal symptoms, buprenorphine has a favorable profile when it comes to lower incidence of NAS, withdrawal syndrome, lower severity, lower duration, for example.
Nadis, what is SilverSummit Healthplan all about, and why is it important to partner with this center?
Of course, thank you so much. Well, first of all, good morning.
Good morning.
SilverSummit Healthplan is a managed care organization, and we provide health insurance to Nevadans that qualify for Medicaid. And it is important to us because it is our mission to improve the lives of the community one member at a time. So what is more important than preventing deaths for mothers and for babies? What can we name that's more important? Our partnerships are important to drive our mission, and we have to partner with organizations such as High Risk Pregnancy, which is why we're so invested in making donations to programs that bring about treatment, which we know there's a shortage of, many shortages here in our state, one of those being treatment for mothers for opioid use.
Yeah, and how will the Mother program benefit SilverSummit members?
Oh, it won't just benefit SilverSummit members, it benefits the community. So mothers need access to these type of services so that they can have better outcomes, right? Again, it's about saving lives. It's about saving the lives of the mothers, improving the lives of the mothers, and about saving the lives of the babies. So what better cause is there but to improve the outcomes of birthing people in our state?
Yes. Janine, for our viewers who may be watching and may be in need of services, how can they learn more, make an appointment, or just find out maybe what types of resources they might need as well?
Yeah, well, you can utilize our website at hrpregnancy.com. I also have a direct line. And it's pretty available to anybody at any time. So you can call my direct line, you can call the main line. We have 3 locations in Nevada or in Las Vegas. And then we also treat patients in Reno as well.
Well, we really appreciate you guys coming in this morning. And what's more important than seeing some action being taken than a group of different organizations coming together to make a difference. And I'm sure there is at least one person, if not more, at home watching right now who will surely benefit from this conversation this morning.
Or know somebody as well who might need it as well.
Yeah. Thank you. Thank you very much.
Thank you.
So if you or anyone needs to take advantage of the services offered by either the Mother Program or SilverSummit Healthcare, visit hrpregnancy.com.